My name is Carolyn Chudy. I'm a physiatrist and I treat pelvic pain here at Pelvic Rehabilitation Medicine. I treat both male and female patients of all ages. My medical credentials are, I did my 4-year residency in physical medicine and rehabilitation at Cornell and Columbia joint program, and I did an additional 1-year fellowship in interventional spine and sports medicine at Columbia, with a big focus in ultrasound for both diagnostics and treatment, as well as X-ray guided injections and treatment. So I became a physiatrist in order to help people restore their function, and particularly with pelvic pain. I started out in a sports medicine practice where I saw a lot of patients with hip pain, and those patients, even with traditional treatment for hip pain, they sometimes were not getting better. So I found that doing pelvic floor evaluations and treating pelvic floor was helpful in getting those patients better. And through doing that, I learned there was a whole world out there of patients with pelvic pain that were really suffering, and found that this was a great place for me. Our Manhattan office is really centrally located. We are located near Grand Central, Bryant Park, near the main library. We have great access to all the subways really, and the LARR, as well as Amtrak's. We have patients coming from all over the area, all the boroughs, Long Island, Westchester, Staten Island, even Connecticut, New Jersey. Pelvic pain is hugely important in a really underserved area of medicine. A lot of doctors don't learn how to treat pelvic pain, and so I found that treating these kinds of patients at Pelvic Rehabilitation Medicine has been extremely rewarding. Pelvic Rehabilitation Medicine is a practice where we see patients of all ages, all genders, and of really all pelvic pain complaints. So we see patients with urinary, bowel, bladder, abdominal, vaginal, penile, testicular pains, and those are often associated with other conditions such as migraine headaches, TMJ, low back pain, anxiety, depression, sometimes scoliosis, and we have to put the whole picture together as to how the patients got this pain and how we can treat them. The goal at Pelvic Rehabilitation Medicine is to resolve pelvic pain. We want to use a multidisciplinary approach to treatment, including all modalities that are available to us. We really treat holistically. We want to look at the whole body and the whole person and find the treatment that will be most useful for that particular individual.